What you see here on this picture is the gastric bypass surgery. So this is what we look like before surgery. This is normal anatomy. So esophagus, stomach, and the small intestine. And this is what you look like on the inside after a gastric bypass. A gastric bypass is a laparoscopic procedure. It's done in full anesthesia, so the patient is sleeping during the surgery. And the average operating time at our unit is roughly 35 minutes. So there are three mechanisms behind a gastric bypass and the weight loss you get. One of the more obvious ones is the fact that you get a very small stomach, and that means that you will feel satiety out of a very small meal. But on the other hand, of course, you have to alter your food habits, what you eat, how fast you eat, and how often you eat. The second mechanism is that you will feel less hunger even though you're losing a lot of weight. The reason for this is that we bypass an area here with a lot of ghrelin cells, a lot of cells that produce starvation hormones. And the third mechanism is this operation on the small intestine. And the mechanisms behind the effect here is a bit more complicated, but roughly you can say it will increase your metabolism when you eat a meal, and it will also alter your food preferences to healthier foods. The advantage of a gastric bypass procedure is that it's the most effective one when it comes to long-term weight loss. It's been around for a long time, so we know what the long-term outcomes are. The potential negative to doing a gastric bypass operation is that you have about 1% risk of getting bowel obstruction after a couple of years, which usually results in you having to get a new operating procedure done to correct it. So this is the gastric bypass.